Great. All right, good afternoon, everybody. We are here to talk about Lung Cancer Awareness Month in the Capitol. But let me start by sharing a piece of news that's also critical for our health here in the Commonwealth and getting through this pandemic that we're going through. About 30 minutes ago, I signed an executive order that now qualifies anyone over 18 years old in this Commonwealth for their booster. Incredibly important that people get out there and not only get vaccinated, but get their booster. There's been too much confusion, and with either a plateau or a slight uptick in cases and hospitalizations, now was the time. So everybody over 18, it's been 6 months since your second shot. You need to go out and get your booster, and now you should be able to. Okay, for today's event, and thank you for sharing a little bit of that time for the right thing. Good afternoon, everybody, and thank you for allowing me to join you today to discuss an important issue that impacts so many Kentuckians, and that's lung cancer. In just a moment, I'll be signing a proclamation declaring November 2021 as Lung Cancer Awareness Month in the Commonwealth. The awareness part of today's proclamation is more important than usual. Often, we mean to put a spotlight or raise general awareness about an issue or a concern. We're doing that today, of course, but awareness when it comes to lung cancer has the potential to save lives. Unfortunately, Kentucky has the highest lung cancer rate in the nation, with more than 89 out of every 100,000 people diagnosed. And unfortunately, our death rate for this disease is 50% higher than the national average. In fact, it's estimated that 22% of all U.S. cancer deaths each year happen in Kentucky. That is heartbreaking. Those are our friends and our neighbors, people we care about, children of God, irreplaceable, and we must do better. Receiving a cancer diagnosis is one of the most upsetting, stressful things that can happen to you or to someone you love. Well, not lung cancer. I remember that conversation with my dad, with my aunt, who's no longer here with us. It upends your whole world. If it's happened to you personally or to a family member, it's shock, grave uncertainty, and constant worry that goes with something that feels like it's lingering over you. But talk to the oncologists and other healthcare heroes who treat and care for patients every day, and they will tell you that the true problem often isn't getting a cancer diagnosis, it's not getting one early enough. They'll tell you that getting a diagnosis can be and should be the beginning of healing. The earlier they can detect, the better the chances are for return to long-term health and long life. And we're seeing improvements in screening and early detection, which is incredible news. But we got a lot of work to do to educate Kentuckians, to make sure we catch each one of these diagnoses early and thus can provide the most help, the best help, and the best treatment. We've got to encourage and educate Kentuckians about prevention and what to do when they've received that diagnosis. While the Commonwealth is second in the nation in lung cancer screenings, nearly 11% of those diagnosed with lung cancer do not receive cancer treatment. That's devastating to think about. Mothers, fathers, grandparents, and children, every single one of them deserves not just treatment, but the very best we can provide them. And I'm proud we have incredible healthcare heroes across our state who can help provide the quality care and treatment. A program like UK's Healthcare's Marquee Cancer Center provide treatment options for patients, increasing chances for survival. I owe the survival of my father to that facility more than 20 years ago. These leaders are indispensable Team Kentucky partners when it comes to a major goal of my administration, and that's making sure healthcare is accepted as a basic human right, and it's accessible to everybody across the Commonwealth. Even before I had any idea that the majority of the first 2 years that I would spend in this office would be spent fighting a pandemic, I was laser focused on healthcare. One of the first acts I took in the first 5 days in office was to roll back a Medicaid waiver that could have left people without coverage, without the ability to get the screening and the care that they need. It was about 100,000 individuals. And I think back to what these last 2 years could have been like for them, whether the pandemic or other issues that could have sprouted up in their lives. I went to bat in fighting for the Affordable Care Act to ensure that those with pre-existing conditions, which we all have, must be covered, that nobody could be kicked off their insurance because of a diagnosis like this. And I'm proud to say we ended up winning that case in front of the U.S. Supreme Court, and that coverage is now guaranteed. And in March, I signed several bills into law. I appreciate Leader Jenkins being here today, who pushed so many of those that strengthened our healthcare capacity and improved access. And we've worked to expand mental health services that so often are so important in going along with something like the diagnosis we're talking here, to remove barriers for coverage and ensure that we can treat the whole human being and not just one affliction. We signed House Bill 108, which provides medically necessary genetic cancer testing to give Kentuckians the best chance for long, healthy lives. And the progress we've made on cancer treatment and care is because of advocates like the ones that we have here today. Thanks to leaders from Kentucky Leads Collaborative, Stages, American Cancer Society, Cancer Action Network, the American Lung Association, Go-To Lung Cancer Foundation, Kentucky Cancer Consortium, and Longevity Foundation. Thank you for all your work and for everybody who is stepping up, whether as an advocate or to share your story. Sometimes being willing to share something that is so personal is what can break through to an individual to get that screening, to know that its importance, and to ultimately do the right thing. So folks, please review the CDC guidelines and talk with your doctor if you believe that you are at risk. Please schedule a screening. Early detection not only can, but absolutely does save lives. So with that, I'd like to invite Dr. Timothy Mullett of the University of Kentucky and Markey Cancer Center to give some remarks. Let's do the signing at the end because I want to make sure everybody here can be a part of it. Doctor?
Thank you.
Thank you.
Actually, if you'll stay for just a moment.
Yes, sir.
I want to start by saying I appreciate the opportunity to be here today. Appreciate the chance to be able to recognize this Lung Cancer Awareness Month. But before I get into some prepared remarks, I wanted to start with a pen. And this is a pen whose life began toiling as decades as a tobacco stake. And I took the wood from the tobacco stake and made it into your pen. And ultimately, this pen of transformation should be able to move from where it spent time in the tobacco fields to the point where it can now go to your desk and be able to make positive changes in our state.
Thank you.
And so we certainly appreciate that.
I appreciate it.
Absolutely.
Thank you.
It's also a pen of transformation because it began as in a tobacco field, and it was picked up as it was discarded in the back of what is now a vineyard, which is made the economic transformation for our state to be able to move us into a point of positive impact in that regard. Making award-winning wines, who I will admit, my son is the winemaker, so it's a good place to be. So
that's a good plug.
So certainly it is an honor to be here and receive this for the Kentucky Leads Collaborative. You know, this is a project standing on the foundation of a collaboration of the University of Kentucky Markey Cancer Center, U of L Brown Cancer Center, and the Go-To Foundation for Lung Cancer. And I certainly want to add my welcome to representatives and special guests and all of you for being able to join us and recognize Lung Cancer Awareness Month. Certainly, originally, this concept developed with Dr. Jamie Stutz, and it was supported by the Bristol Myers Squibb Foundation and the Kentucky Cancer Consortium Lung Cancer Network under the direction of Dr. Jennifer Knight and the Kentucky Lung Cancer Research Program, a project that was founded in 2000 and has had so much impact to lead lung cancer research across our Commonwealth. The burden of lung cancer on the people of Kentucky is unequaled. It influences the lives of all of our population. And as a surgeon operating on lung cancer patients in Kentucky for over 25 years, it's been a privilege to be able to offer most patients that conversation with early stage disease and encouraging news of a curative operation. But I've been frustrated by the fact that, as described, far too few are able to hear this message. And as early detection has been an enigma in past decades, this frustration has also been shared by my oncology colleagues who have been treating patients with late-stage disease, often where survival has been elusive. But today, we stand in the Rotunda in Kentucky, ground zero for lung cancer challenges in the country, in a very different perspective than where we have been. Kentucky is now a leader in the nation in early detection, bringing the people more curative operations and more treatments that are effective, delivered from the results of research that the state has provided. Research that your office and legislature has supported, and hard work of many of the healthcare organizations across the state and advocacy groups most represented here. We're certainly witnessing less late-stage diagnosis than we have seen before. And this is an important transition because that's an indication that early-stage diagnosis is moving those patients a stage shift into that early phase of lung cancer, where we have much more opportunities for treatment and effective management. So this is the delivery of optimal lung cancer screening, what we were hoping to deliver from our LEADS collaborative experience. Additionally, we have promise for those late-stage patients. And over the last few years, effective targeted chemotherapy or immunotherapy is expanding on the use of tumor biomarkers. And certainly many of these patients have dramatically more effective treatment than we've seen with conventional therapy. In 2014, we were here and we introduced the Kentucky LEADS Collaborative in the Rotunda with your father. And we were optimistic that we would see change. We would offer a new hope for Kentuckians to expand education, awareness, early detection, and survivorship in lung cancer. Lung cancer is Kentucky's cancer. It is our burden. It is our responsibility. And we hope that we can continue to fund research and to fight all aspects of this with effective tobacco treatment, radon detection, enhanced awareness, discovery of these new medications, and effective delivery strategies for these new treatments. The country is looking to Kentucky now. We want to continue to lead. And I want to thank the organizers of this event and so many that have helped us move this forward. Mostly, I want to thank the thousands of lung cancer patients and their families and loved ones who have certainly deserving the recognition in this fight, and we must fight for them. Now, along my journey, I've met hundreds of people who have a passion to change our quandary in lung cancer. Scott Kindred is a colleague who has helped me care for patients in and around the operating room at the University of Kentucky. He's a patient who's battled this disease in its many forms. And in many ways, he's emerging as a positive influence. And he's also an advocate, offering hope and encouragement to patients with lung cancer. Mostly, he's a friend. And so with that, I give you Scott Kindred.
Well, thank you, Dr. Mullet and Governor Beshear, for hearing us on such an important topic of lung cancer in Kentucky. Myself, being a two-time lung cancer survivor, I know all too well how important of having a good relationship with someone's medical team. For myself in healthcare, a little over 2 decades, I would see, notice, and care for others, also helping them with their needs. So many patients, including myself at one time, after a diagnosis or treatment, will resort to Google for information, and social medias are also very active with patients and survivors looking for support or advice. Yet on a local level, I believe we can do better. That's why it's so important for research and funding in Kentucky. for Kentucky. My experiences started in mid-2014 when I had the right upper part of my lung removed, followed with routine scans. Everything seemed to be all clear. In 2016, the cancer had returned and mets to my bones. I was diagnosed stage 4. At that time, chemos were the recommended treatment, which at the time I refused and advocated for immunotherapy from research information I had learned. Along with making advances in these type of treatments, along with research are so very important. I started, like many, Googling support groups in Kentucky and found nothing. I started drawing up what I called stages. The name fit because there are stages of grief, stages of cancer, all the emotions that come along from a cancer diagnosis. On the header, I used a picture of a pier that I had taken as a reference. And the picture of the pier references if each person was a pillar in that pier, it can reach out something that is normally unreachable by coming together. At my own cost for the last several years, I've tried to help boost the struggles and treatments of buying hundreds of silicone armbands that I would hand out freely that says, "Keep moving, never die easy." I kind of pay for these out of my own pocket and never expect anything in return, but hoping someone gets what they need from those armbands to push forward in the struggle of a cancer diagnosis. I feel with COVID, it's allowed us to embrace technology a little better through Zoom and social medias to come together for support groups. Kentucky being a high state with lung cancer diagnosis, I believe we can do better through funding treatments and supporting those that are needed, along with better knowledge of the diagnosis through research and advancements in treatments. I want to thank Dr. Mullet for having me here today, along with Governor Beshear for having me as well and hearing this on such an important topic. Thank you very much. I hope that even with stages being with University of Kentucky, that was a lung cancer group that I came up with the name Stages, again, because there's stages of grief, stages of everything. So I thought the name fit and I moved forward with that. But thank you for your time and thank you.
I'd recognize Representative Joni Jenkins. We also have Representative Moser, who is here today, who has championed a number of healthcare bills, and we appreciate, I think, all of our understanding that accessible, affordable healthcare isn't red or blue, Democrat or Republican. It is life or death, and thank you for both of your efforts. My faith teaches me that we are all our brother and our sister's keepers. Recognizing this month and creating awareness is just one small thing we can do that'll hopefully reach some people and create some different outcomes. But just like we have to be there with those for those families struggling from COVID long after this pandemic, we're going to need to be there for families struggling with cancer. But my hope is, just like this pandemic, that this is an enemy that we can one day defeat, and we will continue to push forward to that. So thank you. God bless you. We're going to sign a proclamation. My suggestion is, why don't we get one photo, if we can, with the small group that you all want, and then let's get one, because there's two parts of my name, let's get one with everybody who wants to be a part. Okay. Doc, who you want to be in the first one? Everybody to come like that. You're killing me, man. Right, looking up. Good. That's right. All right. Thank you all very much.